Howdy everybody and welcome to my Poop Tip Tuesday. I'm so excited to be on tonight. I want to thank you for watching today. So sorry about last week. It was spring break. I was gone. But for those guys who are joining today, we have a great show today. We're going to talk about juicing. Does it help out with digestion? We'll talk about the great debate between a bidet and using toilet paper. Oh my goodness. Questions that you guys have asked me as well. We'll talk about, is it safe or healthy to have the sugars in fruits? And then we'll also talk about why things may be getting stuck in your bottom and what to do about that. And your live questions today on today's Poop Tip Tuesdays. Guys, let's talk about poop. Hey guys, my name is Dr. Samir Islam. My passion is to give you tips and tricks to help out with your gut health. I grew up in a small town called Odessa, Texas. You may have known that from the movie Friday Night Lights or even the TV show. I did my undergrad at the University of Texas at Austin, go Longhorns, and I did my GI fellowship training at the Mayo Clinic. So guys, let's talk about poop. All right, so I need you guys to do a couple of things. Number one, let me know if you're watching live or on the replay. And also let me know as well where you are watching on today's Poop Tip Tuesday. All right, Sir Law, thank you for watching. And yes, you need the scoop on poop. I need the scoop on poop as well, and I'll give that to you. If you guys have any questions, also comment down below. So question number one, I got this from a question that I got from a patient today. Hey, Dr. Islam, is it true that juicing helps out with digestion? Okay, I've seen a lot of things on social media and on the internet about the benefits of juicing, how juicing can help out with your gut, how juicing can help out with your indigestion, how juicing can do all these magical things. So, like everything, I want to tell you the truth. I want to give you the evidence. So here's what we know about juicing. We have absolutely no clinical evidence at all that juicing is better for your health than maybe having the actual fruits or vegetables. No evidence whatsoever. There's no evidence that juicing will activate particular enzymes and make things better. There's no evidence that juicing will actually improve your gut microbiome. There's no evidence whatsoever. What we do have evidence for is that we know that fruits and vegetables for sure are a foundation for the best gut health that you can have and to best improve your gut microbiome. The best predictor of a healthy microbiome is to have a diversity of plants and fruits. By far, this is better than any probiotic, any pill that I can give you. And the best way to do this is to actually eat those foods and ingest them and have that. Here's the problem when it comes to juicing is that for a lot of people who juice or have the juices, the fiber or the pulp is taken outside of that particular juice. And so you're left with all that sugar and all that liquid without all some of the benefits that can occur whenever you ingest fiber as well. And that's the important thing. Also keep in mind that juicing can sometimes make gut issues worse, like indigestion. If you have juicing that has lemon or orange juice, those are citrus foods that can really aggravate your GI tract and make reflux and indigestion a lot worse as well. Now, if you're able to have a juicing mechanism which you can keep all that pulp, keep all that fiber, that's perfectly fine. I'm okay with that. If you're able to do it, that's great. And if you need to have a juice fruit that you make yourself because you want to improve your gut microbiome, to improve your health of your gut bacteria, and to get all that fiber that's there, I am fine with that as well. But juicing in of itself, there's no clear benefit that it's going to help out with what is going on. Now, if you want to try different things to help out with your gut, things like chamomile tea, can't speak. Chamomile tea will work. Cypri elm will work. And licorice will work as well. Those are things that can help out when it comes to your gut health. All right. Question number 2. B, it's good seeing you. Thank you for watching on the live video. Next question. Do you need to worry about sugars whenever you eat fruit? This is a very common question that I get. I've seen this on the internet about how sometimes you should not be having fruit because of the high sugar content that's there, and how this can maybe increase your insulin and make it a lot more likely for you to gain weight and cause all sorts of problems. I've seen so many people question this and actually have their own thoughts about this. Let's go through the evidence that we know. So we know that the fruits that have a lot of sugar or a lot of sugar in them, like, for example, things like melons or pineapples or anything else like that, we know that the main sugar that's there is called fructose. Now, fructose for most people is not the same type of sugar as what you would get from granulated sugar that you get outside. For most people, fructose does not cause a lot of the other issues that you're worried about. But the other important thing you need to worry about the other thing you need to know when it comes to sugars in fruits is that fruits have a lot of other benefits with them to negate some of those concerns people have about sugar. It's got fiber, like I mentioned before. It's got vitamins. It's got minerals, it has antioxidants, it has a lot of other options that we can give to help out with what's going on inside your gut and to make things better as well. And so we have no evidence that sugar from fruits will increase your insulin, cause you to gain weight, and cause you to have any significant problems than what we would normally have if you had just an excess of calories. There's nothing inherently wrong with those sugars, and there's nothing inherently wrong with what is going on whenever you try to ingest that. So I would not worry about that. That is something you don't have to worry about. And this is one thing I want you to do to help improve what's going on with your health, is to improve the amount of fruits and to improve the amount of vegetables. So keep in mind, I want you to really try to do what you can to help your gut health naturally. All right, question number 3 that we have for you. Bidets versus toilet paper. Dr. Islam, what are your thoughts? All right, I will tell you, I am 100% pro bidet. Yes, bidets. Bidets are fantastic. If you don't know what a bidet is, basically it's like a little spray to your bottom that helps to keep you clean and also keeps you more hygienic. And then when it comes to the differences between using a bidet and using toilet paper, for sure, a bidet is more effective. It keeps you clean. It does things better for you, and it helps to make sure that you don't have a lot of other problems for that. Bidets by far are a cure for maybe you're having a little problems with keeping yourself clean. Maybe you have some streaks in your underwear. Maybe you're just trying to make sure you're hygienic. Bidets by far work great. They're available all over Amazon. They're easy to install. And I'm such a big proponent of bidets. I would recommend that anyone who can use a bidet and hopefully improve what's going on down below. All right. Question number 4. Why does spicy foods give you the runs? All right, this is a great question I got from Instagram on a DM. So let me know how many of you guys have experienced really bad diarrhea whenever you have spicy food. I will tell you, it's happened to me, unfortunately. It happens to a lot of people as well. What is going on? Well, there are a couple things. Number one is that the natural ingredients in spicy foods can really irritate what is going on inside your GI tract. They actually activate a couple different receptors all throughout your GI tract. And these receptors are ones that help to stimulate the contraction of what's going on both in your colon, your small intestine, and also your rectum as well. In addition, spices have a particular ingredient called capsaicin. Now, capsaicin is the actual ingredient that actually makes it feel like that things are hot. So whenever you first ingest capsaicin, your body reacts to this, and one of the ways your body reacts is to produce endorphin. So this is one of the reasons why whenever you have spicy foods, you may have a sense of euphoria. You feel great, like, oh, it feels really, really good. And it kind of brings on that stimulus to have more and more spicy foods. And that capsaicin also activates receptors inside your stomach that really push things through a lot quicker because your body does not like all that spice. It wants to try and get it out of your system. And so it goes into your small intestine. Your small intestine also have these receptors that the capsaicin attacks to and actually goes throughout your whole small intestine as well and tries to get out of there. And same thing within your colon as well. Your colon have these receptors that try to have that capsaicin on there and it gets it out of that colon. And then lastly, this is also the reason why you have some of that pain in your bottom whenever you have the spicy foods. You have a lot of those receptors in the rectum themselves that become very innervated, become very activated, and can really cause irritation to occur. So this is one of the reasons why you may be having spicy butt. And I have a video on what you can do to help out with that. So it's a great question that I got. All right, this is a great question. So about bidets, let's go on there. So bidets, but do you wipe first after a bowel movement before using the bidet? Can a bidet spread bacteria to the vaginal area? It's a very good question. I will tell you, we have no evidence at all that a bidet will actually spread bacteria elsewhere beyond where it needs to be. There's no evidence for that. So it is very clean. It is very safe. and then typically it does the job that we need to do. Great question. Let me know in the comments down below if you have any more questions. Also, let me know if you're coming in late, where you are watching this from, and if you're watching this live or on the replay as well. Let me know in the comments. All right. Last question. Dr. Islam, why does poop get stuck in my bottom? All right. So there are so many people out there who have this issue in which poop just gets stuck in your bottom. You're like, oh my gosh, what is going on? I can't get it out. What can I do to get this taken care of? And what can I do to make it better? Well, the most common reason is that you may have a condition called pelvic floor dysfunction. In essence, you are literally anally retentive. Things don't want to pass through. It gets stuck in that bottom area. And for a lot of our patients, this is a reason why they're having constipation and things don't want to pass through and things don't want to go through as well. Now, there are tests that we can do to check for this, and there are treatments that we can do. For a lot of my patients who have this condition in which things are getting stuck, the resolution is not to take more medications because it's not a colon problem. It's a muscle problem in the rectum. So just like, my muscles up here, they get sore, I go through physical therapy. The exact same thing when the muscles of the rectum are too tight. You have to go through physical therapy to relieve that tension, relieve that stress, and to allow things to go through easier. So if you're complaining of things getting stuck, we know how to fix that. Michelle, it's great seeing you. Thank you for watching live. Carol, it's good seeing you as well. Joyce, thank you for watching from Amarillo. Thank you, Unseen World, for watching as well. Travis, great seeing you in Lubbock. And Tanya, it is great seeing you guys as well. So another good question I have here. Do uterine polyps make it more likely for you to develop colon polyps? So the answer is no. Great question. So we can have polyps pretty much anywhere inside our whole body. We can have polyps in our stomach. We can have polyps in our small intestine. We can have polyps in our colon. We can have polyps in our gallbladder. We can have polyps in the uterus. Now, there are some conditions in which you can have polyps all throughout your GI tract. They're not common, but they are there. But polyps in the uterus does not correlate to polyps inside your colon. Polyps in your gallbladder does not correlate to polyps in your colon as well. And polyps in other places outside the GI tract typically don't correspond to polyps in the colon. And so I wouldn't worry about that necessarily unless you have unless you have kind of a rare condition. That's very unlikely for a polyp in another place, especially a uterine polyp, to lead to polyps inside the colon. Great question. Lisa, it's good seeing you. Thank you for watching live in Lubbock as well. All right, guys, perfect. Well, I want to thank you guys for watching. I want to thank you guys for being on my Poop Tip Tuesday. Let me know in the comments what you guys think about these, what recommendations you have to change. If you want to have a question answered for me, the best way for you to do this is to subscribe to my weekly newsletter. I'll put a link down below, but the newsletter is the best way for me to get the questions answered you guys have. If you just send me a message on my newsletter, I get those. And every couple of months, I usually send out a survey on my newsletter to make sure that we can get the right things for you and to make sure that you have your questions answered as well. I want to thank you for watching. Hope you guys have a happy and healthy Tuesday. Take care, everyone.